Every fall, millions of Americans have the opportunity to review their healthcare coverage during the Medicare Annual Enrollment period, which runs from October 15 through December 7. This is one of the most important windows in the entire Medicare system because it allows people to switch plans, join a new Medicare Advantage plan, change prescription drug coverage, or go back to original Medicare. But with so many choices, rules, and advertisements, it's easy to feel overwhelmed. Unfortunately, many people make critical mistakes during this time, mistakes that end up costing them thousands of dollars or leaving them without the coverage they truly need. In this video, I'm going to walk you through the 5 biggest mistakes you must avoid during the annual enrollment period, so you can make smart, confident choices and protect both your health and your wallet. The first mistake that far too many people make is simply doing nothing. They assume that because they have coverage now, and it seems to be working okay, they don't need to review or make changes. But this is risky. Medicare Advantage and Part D prescription drug plans are allowed to change their costs, their benefits, and even the list of doctors and hospitals they work with every single year. The plan you liked in 2025 may look very different in 2026. For example, your medication might move to a higher cost tier, or your primary care doctor could be dropped from the plan's network. If you don't take the time to review these changes, you might wake up on January 1st with higher bills or less access to care than you expected. The truth is, standing still can be one of the costliest mistakes during AEP. Even if you end up sticking with the same plan, you should still carefully review your annual notice of change to make sure it still fits your needs for the coming year. The second major mistake is choosing a plan just because it has the lowest premium. $0 premium plans are heavily advertised and can sound very appealing. After all, who doesn't like the idea of paying nothing per month for health insurance? But what many people don't realize is that premiums are only one part of the cost equation. A plan with a $0 premium might have high copays every time you see a specialist, or high co-insurance for hospital stays, or expensive out-of-pocket costs for certain medications. Imagine saving $30 a month in premiums, only to pay thousands more when you need care. I've seen countless seniors fall into this trap, thinking they are saving money, when in reality they are paying more. The right plan is not always the cheapest up front. The real measure is how well the plan covers your actual health needs and how much it could cost you overall in the worst-case scenario. Looking only at the premium is like buying a car based only on the sticker price, without checking whether the engine runs. The third mistake to avoid is failing to review your prescription drug coverage. Prescription costs are one of the largest healthcare expenses for seniors, and the formularies, that is, the list of medications a plan covers, can change every year. Just because your medication was covered affordably in 2025 doesn't mean it will be in 2026. Drugs can move to a higher tier, prior authorizations might be added, or coverage can be dropped entirely. If you don't compare plans carefully, you might end up paying hundreds or even thousands of dollars more next year. Medicare's Plan Finder tool allows you to enter your medications and pharmacies, and it will show you exactly how much each plan will cost you. It takes a little bit of effort, but the savings can be enormous. Skipping this step is a huge mistake. I know of one gentleman who stuck with the same Part D plan year after year, only to discover that a drug he took daily was no longer covered the following year. It cost him over $2,000 out of pocket before he realized he could have switched to a different plan that would have covered it for far less. This is why reviewing your prescription coverage during AEP is so important. The fourth mistake is ignoring your future health and lifestyle needs. Too many people select a plan based only on how healthy they are right now. They think, I barely go to the doctor, I don't take many medications, so I'll just pick the cheapest plan. But health can change quickly, especially as we age. If you suddenly need surgery, develop a chronic condition, or start seeing more specialists, the plan you chose might not provide the coverage you need. Likewise, your lifestyle matters. Maybe you plan to travel more, or you spend part of the year in another state. Some plans have very narrow provider networks, and you may find yourself paying out of pocket if you need care away from home. Others may not include extras like dental, vision, or hearing, which you might suddenly need. Choosing a plan without thinking about the future can leave you with large unexpected costs. During AEP, take time to think not only about your current health, but also about what might realistically change in the next year. A little foresight now can save you a lot of trouble later. The fifth and final mistake to avoid is going through this process completely on your own, without asking for help. Medicare is complicated. There are dozens of plan options in most counties, each with its own costs, rules, and networks. It can feel overwhelming to try to sort through it all by yourself. Some people freeze up and do nothing, while others make snap decisions based on the first advertisement they see. But you don't have to go through it alone. Free resources like the State Health Insurance Assistance Program, or SHIP, provide unbiased counseling to help you understand your options. Licensed agents and brokers can also walk you through different plans, though it's important to work with someone trustworthy. Even family members can provide support and help you compare options online. Getting help doesn't mean giving up control, it means making sure you have all the information you need to make the best decision. Don't let pride or confusion prevent you from seeking guidance. Medicare is too important, and the consequences of mistakes can last an entire year. So let's quickly recap the 5 biggest mistakes you must avoid during Medicare's annual enrollment period. Number 1, doing nothing and assuming your current plan will still work. Number 2, choosing a plan based only on its premium. Number 3, failing to review your prescription drug coverage. Number 4, ignoring future health and lifestyle needs. And number 5, trying to handle the process entirely alone without getting help. If you can avoid these pitfalls, you'll be far more likely to find a plan that meets your needs, protects your health, and fits your budget. The Medicare Annual Enrollment period is both an opportunity and a responsibility. From October 15th through December 7th, you have the chance to take control of your healthcare coverage for the coming year. The choices you make during this time will affect you starting January 1, 2026, so it's worth the effort to review carefully and make smart decisions. Don't let deadlines, confusion, or flashy advertisements push you into mistakes. Instead, take your time, compare your options, and get help if you need it. Your health and your finances are worth protecting. If this video helped you understand what mistakes to avoid, please give it a thumbs up and subscribe for more Medicare guidance. Share this video with a friend or family member who is also approaching AEP, because the more prepared we are, the fewer costly mistakes we make. And remember, Medicare doesn't have to be confusing, it just requires careful planning. Take control during this annual enrollment period and make choices that set you up for a healthier, more secure year ahead.